So I bring greeting from my hospital. It's a Mission Gastrocare, comprehensive center for the GI cancer, pancreas and liver. So I have made a small presentations because I feel that visual give you a lot of good idea about the disease and the liver. I have given the title liver the silent hero. The reason behind it is that liver is the only organ which works more than heart. It works 24/7, 365 days till we live, and the number of function it performs. So it is said in literature, nobody has counted exactly, but it is said in literature that liver does around 500 functions in the body. And the biggest thing about liver is that it never complains. If you are climbing the stair at 7th floor or 8th floor, your heart will start complaining. If you are dehydrated, or kidney will start complaining, but a liver will never complain. Right? So that is the reason I said liver is the silent hero. The idea of my presentation is basically to give some historical fun data and something about the surgery about the liver. Right? I've made it very brief. So if you go back 2000 years ago, people used to believe, this is a time when nobody knew that there is a heart inside the body. So everybody used to believe that the liver is the reason for life, and people used to worship the liver. The way we say our loved one, I love you or you are my heart. Actually, people used to say that you are my liver. Even today, there are areas in the world that they say that you are my liver. So history also gave a lot of importance. Around 400 years ago, people identified the heart and the focus shifted from liver to heart, because people realized that heart stops functioning and you are dead. And we human have a tendency to work for the emergency, not for the future. So focus for last 400 years shifted to the heart, and everybody has talked about the heart health. But recently data has changed and the liver returns back and it reclaims its position, because now science has realized that whatever heart attack happens in 40s, 50s or 60s, actually the event starts in 20s and 30s. Heart attack is just one event of the whole metabolic spectrum which started in your 20s. And liver is the first organ which will get affected because of the metabolic problem. So liver is again back for its importance, and it is also important even in non-obese. Apparently non-obese looking person can have a visceral obesity or central obesity, which we don't recognize for just an external look. What first manifestation happens? You do a liver function test and there is something known as liver enzymes. If they are deranged and your sonography says that you have a fatty liver, this is probably the first metabolic event in the body which is going to predict your future after 10 years, 20 years, 30 years. So that is why liver health is very important, and this awareness is lacking not only in the general population, even for doctors also. Reading the liver function test is very tricky. Apparently normal looking liver function test can have a cirrhosis or can have a bad liver. So looking at the liver function test and identifying the problem is very tricky, but a smart person who knows about the liver will tell you what is happening around. Now during 1950s, people were very obsessed with the liver health, and there were a lot of liver pills in the market. These are the two actually brands in US and UK. They have made millions out of these liver pills. They were like over the counter medicines, but they turned out a fraud. And we also have our own liver pills in India. I have just covered it to avoid any lawsuit. But there is no strong evidence which supports that these liver pills are helpful. We are actually obsessed with complex solutions. Even if the solution is simple, we would like to have a complex solution. We humans have a tendency, right? So this was an experiment done by a person called David Latimer. So he basically put some soil, a plant and a water inside a glass bottle, and this survived for 53 years. So this was like a self-sustaining ecosystem. Liver is also same. Liver is also a self-sustaining ecosystem. You don't need to do anything special for the liver. You just avoid harming it. Not doing any harmful thing or stupid things, your liver will take care of itself without any special care. Now coming to the surgeon and liver. So this journey actually didn't start well. If I talk about 50 or 70 years ago, if you undergo surgery for liver, there are 60 to 70% chance that you are dead. The risk of life after liver surgery 70 years ago was somewhere around 60 to 70%. Even today, a lot of people believe, even doctors believe that liver surgery is very high risk. But surgeons quickly realized that liver is not just a piece of meat that you can cut it anyway. So this guy did a very simple but very groundbreaking work. What he did, he injected some resin inside the liver's vessels, which actually solidifies, and he put the liver into the dissolving solutions. The liver mass gets dissolved, and you can actually see the vessels inside the cast of the vessels inside the liver. And this actually completely changed the liver surgery. So basically he found out the pattern inside the liver. This is single unit looking liver is actually 8 segments. It has a standard pattern inside. And if you follow surgical principles of this, the risk of life is less than 1%. We even today operated liver surgery 8 hours, around 7-8 kg liver tumor, and patient is doing well. So liver surgery today it is possible, and the risk of life is less than 1%, which is as same as any major surgery. Now let me take you to the operation theatre. So for example, this is a liver, this is a whole liver, and this is a tumor in the right side of the liver, right? So what I'll do, I'll cut from here. This is the half of the liver out, and the left half is inside the body. This tumor is out inside the body. So that's a tumor which is out, right? Now I have a privilege to start major liver surgeries in the city, and before we started, actually majority of liver surgeries people used to visit Mumbai or Delhi. Today there is no liver surgery which is possible anywhere in the world and not possible in Vadodara. So we are doing almost all liver surgeries in Vadodara for last 10 years. Thank you. Now how much liver we can remove, right? So suppose there is a tumor in the half of the liver, I want to remove 50% of the liver, that's fine. 50% of liver is good enough for the body to survive. If I want to remove 60%, still it is okay. 40% is okay to survive. If I want to remove 70%, still it is okay. Which means that our human body needs 25 to 30% of normal liver to survive. And this is the reason a lot of patients, chronic alcoholic, they come back and say that 15 days ago I was completely alright and suddenly I have symptoms. That was because you have a 70% extra liver. Despite the damage up to the 70%, your liver was doing fine. But suddenly it has crossed 70-75% and you start appearing the symptoms. Now, so it is the only solid organ in the body which can regenerate. So reason why we can remove this much of liver, that if you do a repeat CT scan after 3 months or 6 months, you will have a completely normal looking liver or close to the normal looking liver. Now suppose I have to remove more than 70%, then what? So we surgeons actually exploit the nature's phenomena. So suppose there is a tumor and I have to remove more than 70% of the liver, I'll block the one side of the vessels of that liver, and very briefly the remaining liver will enlarge. Now I have a good size of liver inside the body and I can remove the tumor, right? So this is how technical manipulation is possible in liver surgery. How can we measure the liver volume? So there are CT scan with the softwares which will exactly give you what is the size of the liver, what is the volume of the tumor, how much you are going to remove, how much is going to stay inside the body. And everything is available in Baroda. Now suppose your whole liver is bad. So I'm taking you to the inside the body. So that's a normal looking liver and that's a cirrhotic liver. You can see the difference, right? It's an irregular, hard, shrunken liver. This is a smooth, soft, supple liver. Now if your whole liver is bad and the functions are not adequate for the body, what is the solution? So there are machines for kidney, there are machines for heart, but there is no machine for liver. If a liver has failed, there is no machine which can function temporarily or can support your body in the absence of the liver. So the only solutions we have are the liver transplant, right? So I'll just give you a basic idea about liver transplant. So there are two types of liver transplant. One is called DDLT, disease donor liver transplant, which means that dead person which donates the liver, but every dead person cannot donate the liver. There is a criteria called brain dead donor, which means that brain is dead but rest of the body is functioning, so heart is functioning. And there are criteria where you can diagnose that this brain is irreversibly damaged and this person is never going to wake up. And that patient can donate the liver. So we remove the diseased donor from the patient We take the brain dead person, the whole liver, and transplant it into the patient. There is something also known as a LDLT, that is a living donor liver transplant, where a person's first or second degree family member can donate the liver, but as I said, liver can regenerate and a normal person needs only 30% liver. So the healthy family member will donate 50 to 60% of the liver, that half will go to the patient and both will survive. So after 3 to 6 months, both will have a normal sized liver. But obviously living donor liver transplant is a major surgery. Donor also has a risk. That is the negative part. But on an average, risk to the donor ranges in the range of 0.1 to 0.5%, including life. So the disease donor liver transplant obviously preferred because there is no risk to the donor. But in our country, people don't donate frequently. And that is the reason the patient does not have enough time to wait for somebody to donate. That is the reason the living donor liver transplant happens. And India is a hotspot for the living donor liver transplant in the world. We are doing highest living donor liver transplant in the world. On an average, India does around 4,000 liver transplant to 5,000 liver transplant every year, which is third to US and China in the world. The US and China, most of the transplants are disease donor because they donate. In India, it is most of the living donor. So we are doing highest living donor liver transplant in the world. This is just a blood group idea. So basically blood group should be matching. Otherwise there is no need to match anything else. The donor should be fit. Patient should have a fitness for the surgery and the transplant can go ahead. So we also have a privilege to do first liver transplant in the Vadodara. In 1 year we did 3 liver transplants. So today the liver transplant was the only surgery which was pending, which we didn't do in last 10 years, which also we finished that journey also. And today there is no liver surgery which has been done anywhere in the world and we have not done in the Vadodara. So he's actually my mentor, Dr. Samiran Nandi. He has been an instrumental in bringing the liver transplant in our country. He actually drafted the Organ Transplant Act. And after that, the donation started, and after that, the India became a huge center for the liver transplant. We have a lot of medical tourism for liver transplant, patients coming from the outside the India. So I'll just end with one interesting and little funny case. So this is a CT scan of a 40-year-old male patient. Patient is from Madhya Pradesh. He had some complaint, went to some doctor in Madhya Pradesh, and he got the CT done. And this is a CT scan which is showing multiple lesions in the liver. So the doctor said that you have a stage 4 cancer and your expected life is less than 6 months, within months. He came to us. So there were multiple lesions in the liver, but his clinical things, ideal appearance was not matching. So we investigated further and we realized that it's a fungal infection of the liver, which has a similar look to the cancer. We gave the antifungal treatment and the patient becomes completely alright. So that is a change of perspectives, how it works. You know? But funny thing is different. So this patient was also taking a parallel treatment from some Baba. I will cover the name again to avoid the lawsuit. And he has been telling everywhere that allopathic doctor said that it was a stage 4 cancer and life is within months, but the Baba cured the disease. But that's a routine part of our life. So I'll just end with a take-home message. Liver is the most hardworking organ in our body. If you will save your liver, you will save your heart. Don't focus on the heart, focus on the liver. It's very simple. Healthy diet, no alcohol, no smoking, no tobacco. Maintain normal weight and have some activity. I know a lot of people have a question for the alcohol. So I'm sure Dr. Ashish will tell you, but I'll give you a brief idea. So there are studies which says that the moderate amount of alcohol is healthy for the body. But I'll tell you, so many of these studies are commercially driven. They are sponsored. And if you look at the overall data, there is no alcohol is safe. So no amount of alcohol is safe. We have seen patients having a very small amount of alcohol and doing very bad. We have seen the patients, they are chronic alcoholics and they are doing well. But it is our life and one life. It is better to save rather than believe that some amount of alcohol is healthy. Thank you.